Shalom. Call Allah Yahweh Ba'ashem Yahushai Ba'ashem Kakodash. Double honors to the apostles and elders of Great Millstone who rule well. Peace and salutations, brothers and hope elect out there pushing this word in truth and sincerity. Alright, this video here is going to be Jake, you have been categorized. Alright, on the screen here you see an article and it says, a natural disaster in all 50 states is unfolding just as travelers disperse nationwide after Thanksgiving. So I'm going to read a little bit of this article here. And it says from CNN, as millions of Americans head home after Thanksgiving, the coronavirus could be hitching a ride, threatening to plant seeds of infection across the country as the U.S. on Sunday topped more than 100,000 new cases for the 27th consecutive day. So far, Sunday, the United States has reported 109,671 new cases and 731 deaths, according to the Johns Hopkins University. A surge of new travel-related infections could overwhelm hospitals already stretched to capacity. Hospitalizations of COVID-19 patients reached a record high of 93,238 on Sunday, trumping Saturday's record-breaking 91,635 figure, according to the COVID Tracking Project. It is the third time there have been over 90,000 Americans hospitalized with COVID-19. The first being Thursday with 90,481 before a drop to 89,834 Friday that could be attributed to inconsistencies in reporting over Thanksgiving. There is no way that hospitals can be fully prepared for what we're currently facing, emergency medicine physician Dr. Megan Rainey said. This is like a natural disaster occurring in all 50 states at the same time. There are not adequate beds. There are not adequate staff. And because of the lack of national preparation, there is still not adequate supplies, said Rainey, a CNN medical analyst and director of the Brown Lifespan Center for Digital Health at Brown University. Here in Rhode Island, we are currently planning to open our field hospital on Tuesday because our hospitals are so full of sick COVID-19 patients. But not every state has that option, she said. And even if you open a field hospital, if you have hundreds of staff who are sick, which is what many states across the country are currently facing, if you don't have nurses and doctors and respiratory techs, even a field hospital isn't going to save you. Our healthcare system is literally at the breaking point right now, thanks to COVID-19. And that's, how about Yahushai putting this pestilence out there. Okay. This says, new cases now mean new hospitalizations by Christmas. Sunday is expected to be the busiest air travel day of the entire pandemic, even though the Center for Disease Control and Prevention recommended that Americans not travel for Thanksgiving. Roughly 6 million travelers passed through security at U.S. airports after the CDC's travel warning in the week leading up to Thanksgiving. But it will be weeks before anyone knows how much of a role Thanksgiving gatherings and travel play in new hospitalizations and deaths. When you look at people who are hospitalized today, they were infected 2 weeks ago. Maybe more, said Dr. Jonathan Rayner, a professor of medicine at George Washington University. And then it takes usually another week for folks to succumb to the illness. poll of 61% of Americans changed their Thanksgiving plans due to COVID-19 spikes. So infections picked up on Thanksgiving are going to show up 3 weeks and are going to show up in deaths over Christmas and now New Year's and are going to spread in every state. It is funny because they already, we've already been saying this. After this holiday season, they're going to highly manipulate these numbers to where they're going to be outrageous with these numbers. These positive cases and deaths, as they're going to keep reporting, they're going to continue to break records and you do record highs based on their assumptions on traveling and all this different stuff. But so as I was reading, I was looking at this right here, this COVID tracking project. So I was curious on seeing what exactly is that. So let me get this. So I clicked on that link, and it actually took me to here where it says COVIDtracking.com, the COVID tracking project. It says the public deserves the most complete data available about COVID-19 in the U.S. No official source is providing it, so we are. Okay? So, so based on that, this is your official, quote-unquote, resource for tracking the COVID-19 or Crown Royal 19. Okay? It says, every day our volunteers compile the latest numbers on tests, cases, hospitalizations, and patient outcomes from every U.S. state and territory. All right. So, as of right now, based on the COVID tracking project, they have they've tested 191,149,006 tests. They've gotten test results back and confirmed cases of 13,188,777. All right, and 257,920 deaths as of right now. Okay. But check this out. It says COVID-19 isn't affecting all communities equally. We've partnered with the Boston University Center for Anti-Racist Research to collect the most complete racial data anywhere in the COVID Racial Data Tracker. So check this out. So when I click on the Racial Data Tracker, look at these numbers here. COVID-19 is affecting Black, Indigenous, Latinx, and other people of color the most. Now, bring this truth out to so-called Negroes, Latinos, and Native Americans? Did not they say that we need to get the Blacks, the Natives, and the Hispanics the vaccine first? Categorizing you, baby. That's what they doing. Putting you in a category. Putting you in that box. Stating that you are the problem or this is affecting you the most. So we need to solve that. We need to put you first and giving you the solution. Oh, man. But look at these numbers here. All right. Nationwide, Black people are dying at 2 times the rate of white people. Do you see that? So-called Black people, as they say, so-called Negroes, are dying or at 2 times the rate of so-called white people. And you see how they highlighted and selected just those two? That's funny. Look at those 3 bars. Black or African American, American Indian or Alaskan Native, or Hispanic or Latino. Those are the top 3. You tribes. Look at these notes. We've lost at least 47,242 black lives to COVID-19 to date. Black people account for 19% of COVID-19 deaths where race is known. But I just wanted to point that out. You've been categorized as being the problem. You've been categorized as it's affecting you the most. You know, you're the one that's getting hurt the most. But this is Revelation chapter 12 and 10. It says, and I heard a loud voice saying in heaven, now has come salvation and strength and the kingdom of our power or the kingdom of the Most High and the power of his anointed or Mashiach. For the accuser of our brethren is cast down, which accused them before the Most High day and night. Now, Yahshua went into this on that word accuser, and the Greek word is categoreo. Categoreo. Look at it. It means to categorize. They put you in that box. They've categorized you as being the problem. They've categorized you as being the sickly one. They've categorized you as spreading the disease. Ultimately. So they've categorized you as to being the first to get one of the first to get these vaccines. Okay? Jake, you've been categorized. But, you know, we've already gotten a victory. We've all, you know, long we won't succumb to them. You know, we've overcome it. Okay? So, call hello, Yahweh Shem Yahushai, by Shem Kakwadash. Double on to the Apostle Elder Great Millstone. Hope you're edified and shalom.